Friends, we'll be moving on to another important topic, blunt force injuries, that is laceration. Right? So we discussed about abrasion and contusion. Now the third important injury in a blunt force trauma is laceration. The Latin word, lacer means tear. You need to tear something, right? So this is basically the tear. It is the tear of the skin, right? Sometimes mucous membrane. It is not only the skin, sometimes it can be the tear of mucous membrane, sometimes it can be the tear of a muscle, or sometimes it can be the tear of an organ as well. It can be anything. Basically, it is a tear, that is laceration. I told you it is blunt force trauma. Let us assume, suppose if this is an skin, you have a force on that skin that is getting torn, right? The skin is getting torn, you will be getting something like this, right? You can see these are the vessels, right? You will also see the hair bulb. Remember, friends, the first point that we have to know is when there is a tear, right? You take a piece of paper, tear it away. When you tear it away, you can see the margins. It will be irregular. You can see it has got irregular margin, right? And because of that blunt force, sometimes you can see these areas getting contused, right? You can as well see some kind of bruising over there. Fine. And because of this blunt force acting on the skin, what happens? Whatever structures that you have in the floor, what are the structures that you have in the floor? You may have blood vessel, you will have hair bulb, you will have nerve. Everything will get crushed, right? Everything will get crushed over that area. Fine. So this is another very important point to be discussed, right? Many times it was asked in your examination, right? In one of your exam, they asked this question: in an injury, right, the floor of the wound shows crushed hair bulb. What type of injury it is, right? It's very simple. In the floor of the wound, if you are able to see the crushed structures, then it has to be a blunt force, right? Do remember, you will find in the floor the crushing. Right, crushing of hair bulb, crushing of the vessel can be noted. So because of the blunt force, some kind of neurovascular bundle will be bridging both the edges, right? Remember, these are called as tissue bridges. Do remember, these tissue bridges are present in laceration. Right? So these are the three important keywords that you need to remember with regard to the feature of laceration. Okay, let us see that. You can see the characters. Let us have a look at the character, right? The margins will be irregular and the edges would be contused, right? You can see the contused edges. Fine. Okay. Then the floor of the wound, the hair bulb, the vessel and the nerve, everything will be crushed. Okay, and tissue bridges, it is present in a case of laceration, and when you look at the bleeding, the hemorrhage, it will be lesser when compared to incision, right? It will be lesser. Fine, it will be there, hemorrhage will be there, but it will be relatively less. Okay, so we'll discuss about the reason why later. For now, you remember, right, you will have lesser bleeding in case of laceration. There is one exception, that is scalp laceration. Scalp laceration alone, the bleeding will be more. That is because the vessel in the scalp that is tethered by the fibrotic strands on all sides, that is the reason why it doesn't allow the vessel to constrict after the trauma, right? That's why it keeps on bleeding. Generally, otherwise, the laceration will bleed less. Okay, so you can look at the laceration. This is how the laceration will appear. You can see the typical irregular margins. Okay, and the shape will also be irregular. Fine. Now, when you see a laceration, you can see that this is, let us assume that we have a laceration. I told you it is usually it is irregular. Fine. This is a main wound. But sometimes what happens, right, from the main wound, you can have another extra split will be there, right? You will have a split. Fine. You will have something like this, which is diverging from the main wound, Do remember that is called swallowtail. Swallowtail is something that you get in a laceration. You can see that this is how it will appear. You can see the tear which is just diverging from the main wound. Right? Fine. So this is called swallowtailing, that is seen with laceration. That is seen with laceration. Now, having spoken about the characters, now I'll be discussing about the different types you've got in a laceration. To start with, let us start with the first laceration. But here, what I would like to do is, instead of telling you the laceration name and then the other features, I would like to start with the type of force that it can cause. Right? Recently in one of your units you got similar type of question. For your understanding, for conceptual knowledge, it is better that we start with the kind of force that can cause this type of trauma. Like, let's start with that. Number one, right? If there is a skin which is crushed, if the skin is crushed between two hard objects, if the skin is crushed between two hard objects, you will get what is called as split laceration. Do remember, this is called as split laceration. Right? When I tell you it is skin is crushed between two hard objects, what are the two hard objects? One hard object can be the weapon, another hard object will be the bone. Right? So basically, this type of laceration is seen with a bony prominence. These type of laceration are seen with a bony prominence. For example, it can be seen in the scalp, it can be seen in the shin, it can be seen in the elbow, it can be seen in the zygoma, it can be seen in the chin. You have lot of forehead, you have lot of examples for that. Right? Basically, it's a bony prominence. Right? Wherever you have a bony prominence, you will have split laceration. But one important point that you need to learn here is, see, in general, the bony prominence, the split laceration, what happens is, let us assume patient has come with a split laceration. You look at the margin with a naked eye. When you look at the margin with a naked eye, what happens is, see, it looks like a regular margin. It looks like a regular margin. Okay? You know very well laceration should be having irregular margin, but it looks like a regular margin. You will get confused whether it is an incision or laceration, because if it is a regular margin, it has to be incision. Right? But here what happens, what you have to do is, you need to examine with the magnifying lens. You need to examine with the hand lens or magnifying lens. You can see the small irregular edges. Right? You can see the small irregular edges along with crushing of the tissues in the floor. Right? Crushing will also be there. Small irregular margins will also be there. So that is basically a laceration, but it looks like incision. I repeat it. It's basically a laceration, but it looks like incision. This is called incised looking laceration. Right? So this is called incised looking laceration, which is very, very important to remember. It is not only important for your examination purpose, even it is important for practical purposes. When a patient has come to you with an injury in the forehead, right, for you to see it might look like a regular margin, you will document it as an incision, but apparently it might be looking like an incision, but it is not incision, it is basically a laceration. Because it is a bony prominence, the subcutaneous tissue fat is so less between the skin and the bone, the laceration looks like an incision. The laceration looking like an incision. So do remember, it is very, very important. Whenever you get an injury in a bony prominence, it is very important that you remember that there is an entity called incised looking laceration. At least you need to remember there is an entity called incised looking laceration, and you need to exclude whether it is a laceration or incision. Okay, so that is very, very, very important. Right? Otherwise, it may be false reporting in the medical legal register. It may be false reporting in the wound certificate. There can be a lot of legal consequences that can occur because of that. Okay, so that is very important point to remember. We have what is called as split laceration, also called as incised looking laceration. Laceration number 1. Right? You can see this is a bony prominence wherein you can have a laceration. Fine. Now, there is one more important second type of laceration. The force is whenever you have a heavy blunt force. Whenever you have heavy blunt force which is delivered at an angle to the skin. right? It is not perpendicular, it is delivered at an angle. When it is delivered at an angle to the skin, what happens? You will get what type of force? You will get what is called as pressure with pull force. Pressure with pull. There is a pressure. In addition to that, there is a pull force as well, pull effect as well. Because of which, what happens is there is overstretching of the skin. The skin is overstretched. When the skin is overstretched, what happens? There is stretch laceration, right? There is stretch laceration. This is the second type of laceration that we have to know, right? Because of this stretching of the skin, it gets torn away. When it is getting torn away, you get this stretch laceration. Here is where you get what is called as flapping, right? You get what is called as flapping, and commonly you get this type of stretch laceration in a compound fracture. In a compound fracture, you can get this compound fracture, open fracture, you can get like this. Okay, this is called stretch laceration. Okay, what is the third type? The third type is quite very interesting. See here what happens, there is a grinding compression force. Do remember, listen very carefully. This type of force is called as grinding compression force. Though it sounds very, very complex, it is not complex. It's very simple. Remember, run over injury. It's a grinding compress. There is a compression, there is a rotation, right? Grinding compression force, we get it in run over injury. Not only that, if there is a tangential force, right? If there is a tangential force, right? Or there is a shearing force, okay? All of which produces one type of laceration. What is the type of laceration? That is nothing but avulsion laceration. The skin and the other tissues can get avulsed. We call this as avulsion laceration, right? That avulsed thing, right? That will be that the skin and the tissues will be coming off like a flap. We call it as flaying. We call this as flaying, right? We call this as flaying. If you want me to tell an example, I'll tell you an example. The classical example that you can think of is degloving injury, right? Degloving injury. Separation of the skin and the subcutaneous fat from the deeper tissue, that is degloving injury. Another example is scalping injury. That same thing that occurs in the scalp, that is called scalping, right? Both are examples of what is called as avulsion. I can show you, this is a run over injury, the grinding compression force, right? Or you can say this is shearing force. What is a shearing force? You can see these are the different layers of the skin. When the shearing force happens like this, right, you can see the layers will be sliding over each other. You can see the layers will be shearing. This is the shearing force which is separating the layers, right? When the skin and the other tissues is separated, you will get what is called as avulsion, right? You can see this is avulsion, and what you see is flaying, right? You can see I told you examples of degloving injury. Fine. So remember guys, I told you three mechanisms: split laceration, stretch laceration, and avulsion laceration. This is highly important, right? Any of this can be asked in the examination. Everything is keyword, right? Moving forward, then the less important type of lacerations are tear laceration, wherein there can be a heavy protruding object by a doorknob or something like that. There can be a tear. Then the next type of laceration is cut laceration. The cut laceration is produced by heavy weapon, right? But it has got a sharp surface, right? Sharp edge. Heavy, sharp weapon, right? For example, axe, okay? It has got heaviness and the sharp surface as well. When you have this kind of heavy, sharp weapon, you can say it's a combination of both blunt and sharp, right? The resulting thing will be called as cut laceration, right, which is very synonymous with sharp injury, which we'll be dealing later. For now, you remember I've told you 5 lacerations: split, stretch, avulsion, tear, and cut. Okay, so do remember all these important laceration, which is highly important for your examination purposes. Okay, right. Now moving on to the next injury. So far we were discussing about blunt injuries. Abrasion we have discussed, contusion we have discussed, and laceration also we have discussed. Now the next important injury is your incision. Incised wound. Right, this incised wound is also called a slash. Right, it is also called a slice, or you can also call it as cut injury. Right, for you to understand this concept, for you to understand this wound, do remember only one word, right? That is cut injury. Cut. That is enough. That explains everything. That means it is cutting. Right? How will you cut? Will you cut with a blunt injury or will you cut with a sharp injury? Obviously, you will be cutting with a sharp injury. Right? So this is basically cut injury produced by a sharp weapon. Right? You can see incision. You can say that it is produced by any a sharp weapon, light cutting sharp weapon like a surgical blade. You can say if this happens to be the skin, this happens to be the skin, and this will happen to be the surgical blade. Right, this happens to be the surgical blade, and with that you can keep drawing like this and you will get injury. Okay, so that is basically incision. That is basically incision. Fine. And when you have this, you can see the wound will be appearing like this. Fine. You can, if you want, I can show you the neurovascular bundle as well. So these are the blood vessels. Right, you can see some kind of hair follicle, right, that will also be there. But what have you noticed? Two things that you have to notice. Number one, you can see the margins, they are clean cut and regular. They are clean cut and regular. Fine, that is because of the sharp edge. You take a knife, you cut the cake from top to bottom, you can see it is clean cut, the margins will be clean, right? When you're cutting it, what happens? Everything in the floor is evenly cut, right? That is the reason why, look at the floor. When you look at the floor, the entire neurovascular bundle will be cut, right? Everything will be cut. You can see not only the blood vessels, the hair bulb, everything will be cut in a case of incised wound. You can see everything is cut. Fine, right? Will you see tissue bridges? No, never. You don't see tissue bridges because everything is evenly cut. I told you the concept, so it is evenly cut. You can have a look at this. So this is your incised wound. This is your incised wound. And you can see the characters as well. The margins, I told you, it is clean cut. Right? You can see in the floor, all the hair bulb, vessels and the nerves, everything will be clean cut and there is no tissue bridges. No tissue bridges at all. Right? And bleeding will be more or less, right? You will have profuse hemorrhage, right? That is again one of the very, very important point to be remembered. It was asked in many of your examination, right? I told you when we were discussing laceration, right? The bleeding will be less. In incision, the bleeding will be more. What is the concept? Now you can look at the concept. Let us assume this is the blood vessel. See, when you look at the skin, I have taken everything. I have kept you only blood vessel. Assuming this is the blood vessel, which is in the skin, right? Fine. Now you can see the blood vessel. There is a blunt force like this. You can see the blunt force. When the blunt force is hitting that skin, what happens? It is crushing that particular blood vessel. When it is crushing, bleeding will be less. But what happens to the sharp force? When the sharp force is hitting, it is cutting the blood vessels. The bleeding will obviously more, right? So the point is, bleeding will be there in both laceration and incision, but profuse bleeding will be seen with incision, not with laceration. I told you this concept. Now you can understand this concept. You can retain, remember. Okay, so do remember the point. It is cut. It is cut. Okay, now going forward, you can look at this image, you can look at the injury, look at the orientation of the blade. The blade is not entering perpendicularly, instead it is entering at an angle, it is entering obliquely, right? When it is entering obliquely, when there is an oblique blade entering the skin, what happens? You will get an undermined edges. Right, you will get an undermined edges. You can see that, right? So that is called as beveling. It is called as beveling of wounds. Right? Do remember, make a note of this, guys. This is highly important. Beveling. When do you get beveling? Beveling is seen when the blade enters obliquely. But in which case the blade will be entering obliquely? In which case the blade will enter the skin obliquely, right? It is suggestive of homicide. Right? It is suggestive of homicide. Usually the homicidal wound will be having beveled edges. Right? Suicidal wounds will not have beveled edges. A person who wants to commit suicide, why would you cut in this direction? He will cut like this. He will cut like this. Why would he cut in all the different angles? Right? Not like that. Okay. So do remember, it is basically beveling, which is suggestive of homicidal nature. Right? Fine. So this is what you need to know with regard to this beveling. Fine. Now I told you about the incision, right? But when you describe an incision, what happens? See, whenever you describe an incision, there are 3 dimensions, right? See, abrasion is 2 dimensions, length and breadth, right? Contusion is the same. And you see from living person, right? Laceration is 3 dimensions. You have epidermis is damaged, dermis is also damaged. That's why you get scar, right? Here also the same thing. See, I told you in laceration and incision, right? When compared to abrasion and contusion, abrasion only epidermis involved, contusion only dermis involved. But here you can see both epidermis and dermis getting involved, right? And that is the reason why you get a lot of scars. Fine. Now, as I told you that incision is basically, laceration and incision both will be basically 3 dimensional. So that means what? You will have a length, right? You will have length. You will have breadth, you will have depth, right? Length, breadth and depth. Length, breadth and depth. In an incision, do remember the length will be the maximum dimension, right? The length can be any dimension as long as you draw the blade on the skin. You can start from here, you can go to the leg, come back to the hand, you can move to the hand. So as long as you draw, the incision will be as longer. Right? It is the maximum dimension. Fine. So now coming to the breadth of the incision. So when you talk about the breadth of an incision, the breadth of the incision is little more than the thickness of the blade. Let us say this is the knife. You see the thickness of the blade, right? When you make an incision from this, the breadth of the wound will be little more than the thickness of the blade. Little more than thickness of the blade. Why is that so? Why is that so? Because of what is called as gaping, right? Because of the elasticity of the tissues, there can be retraction of the skin, and that is the reason why you get little more than the thickness of the blade. You call it as gaping. Retraction of the tissues. Retraction of the tissues. Fine. And now coming to the depth. When you talk about depth, you see depth, right? Let us say I take a surgical blade, I make an incision from this side to this side. So what happens is when I start, I apply more pressure, it will be deeper, right? You see, this is the skin. This happens to be the skin. I apply pressure. When I pressure, this is where I start, right? So when I start the incision, I apply more pressure, it will be deeper. As I keep on withdrawing it from this side to that side, what happens is the depth will keep on getting decreased. Depth will keep on getting decreased. At one point of area, the depth is so less, only superficial skin is cut. Sometimes it can even be an abrasion itself. Only an abrasion can be there because it is so superficial. The force is so less, right? What do you mean by that? At the starting point, the head end, it is so deeper. At the tail end where it starts, where it ends, it should be very, very superficial, right? Very, very superficial. And that is the reason why when you look at the incision, you can see the incision, right, will be something like this. Okay, this is where we started. Here the depth will be more. Here the depth will be less. You can see only the superficial skin is cut. It is looking like a tail, and that is the reason why this is called as tailing. Right? Do remember, make a note of it. This is called tailing. And this tailing, what can it tell us? It can tell us what? It can tell us only one thing, that is the direction of the force. It can tell us the direction of force. So this is highly important. I'll show you the image as well so that you will have a better understanding about that. You can see this is your incision. You can see tailing. Okay, and you can also have a look at it. Right, you can see this is basically the tailing. Right, this is basically the tailing, so you need to understand it. Fine. Now let's go forward. Right, so we have discussed what is so important in incision. Right, so what is the medico-legal importance? What is the medico-legal importance? Number one, right, from the healing pattern. Right, from the healing pattern, what can we find out? We can find out the age of the injury, or we can say the times essence injury. Right, from the healing pattern of the incision. Not only that, right, you can also look at the manner. You can also comment on the manner of the injury by the site and the nature of the injury. Right, for example, right, if it is homicide, what kind of incisions, what kind of cut injuries will suggest you that it could be homicide? If there is a cut injury in the ear, right, if there is a cut injury in the nose, right, or if there is any beveled cut, I told you, oblique cut, all these would normally be homicidal. A person will not commit suicide by cutting his nose, cutting his ear, not possible. And moreover, genital cuts, any genitalia injury, right, usually be homicidal nature. Right, the person will not commit suicide by cutting his genitalia. And you see, sometimes very rarely self-inflicted genital injury can be seen when a person is schizophrenic or something, but otherwise it is usually homicidal in nature. Right, and sometimes by looking at the cut injuries, you can also comment on that it can be suicidal. When can you say that? There is one group of injury, right, one phenomenon that is called hesitational cuts. Right, hesitational cuts. What is the hesitational cut? The person is hesitating to cut. It is otherwise called as tentative cuts. It is also called as trial cuts. Right, it is otherwise called as feeler strokes. Right, it is otherwise called as intentional cuts. As I told you, you have a lot of synonyms, and it is important that we need to know the synonyms as well. Right, fine. What is this hesitational cut? When a person is about to commit suicide, right, immediately he will not take a knife and cut. He will not take a knife, he will cut and he will die. Right, the person may be hesitating. Okay, shall I die? Right, he might inflict multiple superficial cuts, multiple superficial parallel cuts, okay, in the which part of the body? In the accessible parts of the body. That is again very important. Accessible parts of the body, right, that is suggestive of hesitational cuts. Right, that is suggestive of hesitational cut, and it tells you that the person has got suicidal tendency. Right, it is telling us that the person has got suicidal tendency. Fine. Multiple superficial parallel cuts in the accessible parts of the body. He will not take a knife, cut in the back and he will die. Accessible parts of the, maybe in the forearm, neck, thigh, abdomen, chest, wherever it is accessible for the person. Right, so this is called hesitational cuts, also called as trial cuts, tentative cuts, intentional cuts. You have a lot of names for that. And suppose if it is in the forearm, let us say in the forearm, see, it will start from the radial side to the ulnar side. So let us assume that the person wants to inflict hesitational cut. He will not take a knife and he will cut from ulnar side to radial side. It will be from the radial side to the ulnar side. So that orientation is also important. Right, so the orientation also here it is significant. Fine. Right, so that is hesitational cut. I can show you that, so you can see the hesitational cuts, multiple cuts, superficial cuts are there. It is suggestive of suicidal nature. Okay. There is one more important phenomenon that we have to know, that is called lacerated looking incision. Lacerated looking incision. I told you incise looking laceration. This is lacerated looking incision. Right? In incise looking laceration, that is basically a laceration, but it looks like incision. But here, it is basically an incision, but it looks like laceration. Right? For what happens, particularly whenever you have a cut injury in a place where you have a lot of skin crease. Right? Whenever you have cut injury in the place where you've got skin crease, for example, you have cut injury in the axilla, scrotum and all, because of the nature of the skin over that part, you can see cut injury also will be looking like an serrated edges. Right? It might look like an serrated edges, might look like an irregular margin. You might think it is laceration. That is not laceration. That is basically incision. Right? What we have to do is stretch the skin and then we need to examine. We need to stretch the skin and we need to examine. That is basically lacerated looking incision. Right? Very important. Okay? Incise looking laceration, laceration looking incision, both are not same. Okay? Both are not same. Now comes the next mechanical injury, that is stab wound. Can also be called as punctured wound. This is quite unique, unlike the other injuries. Right? Why is it unique? Because any instrument or any weapon having a pointed end can cause stab. Okay? Can cause stab. It should be having only one thing. What is that? That only criteria is nothing but the pointed end. Nothing else needed. Pointed end is needed. That is sufficient. Right? You see, this happens to be the skin. Right? And this happens to be the knife. The knife is entering into the skin perpendicularly. Right? It has got pointed end and it is entering perpendicularly into the skin. Like this, what happens is you will have a stab injury which is having a lot of depth. You can see it will be like this. Here the depth is more. Okay. So when it comes to incision, the length is a maximum dimension. When it comes to stab wound, the depth is a maximum dimension. Because you take a knife, you stab, you thrust it inside. Right? The depth will be more in case of this stab wound. So in this stab wound, the skin is the maximum resistance tissue for penetration. Right? Once the skin is penetrated, then the weapon will go inside the tissue with ease. Right? Skin is offering the maximum resistance to the perforation. Right? Penetration, perforation. Fine. Okay. Now we have few more terminologies to be learnt here. Number one, we have something called penetrating injury. Penetrating injury. What do you mean by penetrating injury? Penetrating injury, the stab injury which enters into the cavity. What is that cavity? Right? It can be cranial cavity, it can be thoracic cavity, it can be abdominal cavity, not any other cavity. Okay, so the penetrating injury is one that enters the cavity. Remember, it has got only entry. It has got only entry wounds. Right? That is penetrating. Right? Suppose if the stab wound enters into the cavity, it also exits the cavity. It enters into the cavity, it also exits the cavity. Entry is also there, exit is also there. Then you call it as perforating injury. Right? It has got entry, it has got exit, both will be there. Right? Entry is also there, exit is also there, both will be there. But how to differentiate? Let us assume that you have got one dead body which has got stab injury, one stab injury in the front of the abdomen, another stab injury in the back of the abdomen. How would you know which is entry and which is exit? Right? So logically speaking, right, you need to find out whether the person was stabbed from front to back or back to front. Right? You want to know whether the person was stabbed from back to front, like Katappa verbally, or if the person was stabbed from front to back, you need to know, right? How to differentiate which is entry wound and which is exit wound? You can have few easy points. One is the margin. Look at the margin. If it is entry, margins will be inverted. When it is coming out, margins will be everted. Inverted entry, inverted margin in entry, and it is everted margin in exit. Fine. And look at the size. The size will be larger in case of entry. It will be smaller in case of exit, because in exit you have only the tip coming out, right? And this happens with only one stabbing. You cannot just stab and keep on multiple stabbing. You taking the knife and stabbing, taking the knife and stabbing, like that will totally obliterate the appearance, right? So if it is a pure single stabbing, you can have this kind of appearance. So remember, penetrating, perforating. Now let's talk about the appearance. Let's talk about the appearance of the wounds, right? The characters of the stab wound, the features of the stab wound. You can say whatever you would like to have. Fine. But before that, or you can say features of the stab wound. Before that, you can see, let us say this is the knife, right? This is the knife. Fine. Okay. So this happens to be the handle, right? This happens to be the handle, and this happens to be the guard, hilt guard. Fine. Right. Here you can see this knife is thrusted into the skin and it is producing a stab wound. The stab wound appears like this. Fine. Stab wound appears like this. Fine. Is it clear? Now stay with me. Now here you can see this happens to be the stab wound. Look at the dimensions. So this is the length, right? This is the breadth, right? And the depth will have inside. Okay. And now coming to the weapon which is causing it. This is the weapon. You can see the knife. This is the length of the blade, right? This is the length of the blade. You have the thickness of the blade, and you also have the breadth of the blade. Okay, length is there, breadth is there, and thickness is also there. Likewise, in the stab wound, you have length, you have breadth, and you also have the depth of the stab wound. Let us see whether they correlate or not. How it is corresponding to each other, we'll discuss. Right? Let us discuss. Right. Now let us say the length of the stab wound. Length. The length of the stab wound. The length of the stab wound will be corresponding to the breadth of the blade. Sometimes it will be lesser. Right? It will actually be lesser. That is because of the elasticity of the skin. That is because of the elasticity of the skin. The length will be lesser usually. Now coming to the breadth. Look at the breadth of the stab wound. I told you the breadth of the stab wound is this, right? What corresponds to the breadth of the stab wound? The breadth of the stab wound corresponds to the thickness of the blade. The point is, usually it is more than the thickness of the blade. That is because it is usually more than the thickness of the blade. That is because of the retraction of the tissues. We call it as gaping. Right? Gaping. Because of gaping, it can be little more than the thickness of the blade. Now coming to the depth. Right? The depth of the stab wounds. Right? When you talk about the depth of the stab wound, you can say that corresponds to the length of the blade if it is complete penetration, right? And if it is not perforation, you can say only in case of penetration, and it is complete penetration, you can say the depth will correspond to the length of the blade. And particularly if there is any body part like abdomen which is yielding, any yielding area, right? The depth will be more. The depth will be more. Any yielding part, the depth will be more. Fine? Okay. Now you see the depth of the stab wound. How do you see the depth of the stab wound? You should never see the depth of the stab wound just like that. You should always examine the depth of the stab wound only in case of in OT. You need to take the patient to operation theater. Then you have to examine the depth of the stab wound. And you should never do any kind of probing. No probing should be done. right? You should not do any kind of probing. That is because it can cause fatal bleeding. It can dislodge the clot. The patient can land up with fatal hemorrhage. That can be life endangering to the patient. You're not supposed to do that. Okay, so we need to be very, very careful when you are dealing with the stab injury in a case of like live patient. Okay, so I've told you something about the length, I've told you about the breadth, I've told you about the depth. Now let us talk about the shape of the stab wound. That is again very important, because the shape of the stab wound will tell us a clue about the type of weapon which was used. The type of weapon which was used. Let us see the different types of weapon so that you will have a better understanding about that. Stay with me, right? So let us take one knife, right? This knife happens to be, let us say, this is the knife. Right, what you can see is on both sides they are sharper. You can say this is double-edged knife. I repeat, it is double-edged knife because both the sides are sharper. Okay, both the sides are sharper. When you have this double-edged knife stab the skin, what happens is you will get an injury which is something like this, right? The sharp surface produces sharp angle. This sharp surface produces sharp angle. So basically, if you look at the shape of the stab wound, the shape of the stab wound will be oval, or you can say spindle. Right? So this is double-edged stab. Right? Now let us say single-edged stab. Now let us draw single-edged knife. Fine. So this is the knife. This is the handle. Right? Which is sharper? This side is sharper. Right, this side is blunt. So when this single-edged knife is being used for stabbing, you will get a lot of types of stab wound. You can see something like this, looking like a teardrop. Okay, teardrop. This is produced by sharp side, this is produced by blunt side. You can say teardrop. Or sometimes you can get something like this, right? You can get triangular or wedge. You can say wedge or triangular. Sometimes what happens, there can be because of the blunt edge of the weapon, you can have some splitting of the skin over there, right? You can get some splitting of the skin over there that looks like a tail of a fish. That is why this is called as fish tailing. Do remember, friends, so far I was telling you three types of tailing, right? Number one, that is swallow tailing, that's seen with laceration. Number two, that is tailing, that is seen with incision. Number three, it is fish tailing, that is seen with stab wound. Okay, fish tailing, that is seen with stab wound, that is seen with single-edged stab wound, particularly from the blunt side of the blade. Okay, so this is again very important. I've told you two types of weapon. Now let us have a look at it. You can have this. So you can see this is your double-edged knife stab wound. Both the sides are sharper. You can have a look at it. It's so clear. Okay, it's very clear. So this is the stab wound which is entering into the cavity. You call this as penetrating wound, right? If it has come out, you call it as perforating. It has got only entry, so it's called penetrating wounds, right? You can see this is another weapon, right? You can see the angled edges, acute edges. So this is another stab wound. You can see that it is entering into the thoracic cavity, right? You can see the double-edged knife, stab wound produced by double-edged knife, right? You can see this one. Okay, right? So this is another stab wound. This is the single-edged knife. I told you this is where you get, right, wedge-shaped, triangle-shaped or teardrop, right? This is a double-edged knife wherein you will get, right, oval or spindle. Fine. Now, what if the person was using a screwdriver, right? What if the person was using a screwdriver? What kind of stab wound that you would get, right? So if it is a screwdriver, you see the tip. Okay, if this kind of tip is being used to penetrate, in that case the stab wound will be appearing like this, right? Something like this. Or if this end is being thrusted inside, sometimes you can get a circular hole also, but adjacent areas you can see some kind of bruising over there. If it is a cross tip, right? If it is a cross tip, what happens? You will find, in that case, you will find a stellate, right? Or cruciate tip. All this is produced by screwdriver. right? All this is produced by screwdriver. Otherwise, suppose if the weapon which was used was dinner fork, you will get, right, something like this. Ice pick again, only one thing will be there. You may have bruising just closer to that area. Right, there is one more important concept that I need to tell you. Let us assume that this is a knife, right? This happens to be the knife, okay? And here is where you have what is called as hilt guard. I told you this is hilt guard. The purpose of hilt guard is mainly to ensure that when you are using a knife, your fingers should not slip. Your fingers should not slip and enter into the sharper surface so that you will get cut. So the hilt guard is mainly to ensure that it is not getting slipped. But here the hilt guard, when this kind of weapon, let us see here it is double-edged weapon. Right, this is double-edged weapon. When you use this kind of double-edged weapon, right, to stab a person, this is the skin of a person, right? You stab with this double-edged weapon, and it is a complete penetration. Let us say it's a I'm taking this knife, completely penetrating into the skin. What happens? You will get a double-edged knife producing oval stab wound, something like this, right? In addition to that, this hilt guard will produce an additional injury over that area, right? It can produce a mark over there. Right? You can see something like this. If you want me to put it in another perspective, I can draw something like this. You can see this is a double-edged stab wound. Stab wound produced by a double-edged weapon. On either side, the hilt guard produces, right, injury like this, right? It can be a patterned bruise, or it can be a patterned abrasion. It can be a patterned bruise, or it can also be a patterned abrasion. And this type of injury is called as hilt mark, right? It is called as hilt mark, right? You can as well see here. So this is hilt mark. You can see these are all hilt mark. Can you see that? It's very, very important. Right? What does it tell you? It tells you a lot of information. You can see that is hilt mark. Number one, it tells you that there is complete penetration. You have completely penetrated the blade up to the hilt. That's why you are getting hilt mark, right? So there is a complete penetration, number one, right? Number two, based on this injury, you can find out what kind of weapon could have been used, right? Because they are patterned abrasion contusion, right? The third one is based on the healing pattern of that abrasion or contusion, you can as well tell the time since injury, right? The last and fourth important point is the direction of force. You can say, here you can see that, you could have seen that it has gone perpendicularly, right? That's why you are able to see on both sides. Suppose if it has gone obliquely, only one side you would have seen that, right? So it will also tell you the direction of force, right? So there are a lot of informations given by this hilt mark. So do remember, do make a note of it, do understand this concept. This is very important for your understanding purpose, right? So this is nothing but your hilt mark. Right? Okay, so we have discussed about that. There is one more important aspect that is called concealed punctured wounds. What is that? Concealed punctured wounds. Concealed punctured wounds are the wounds that are present in the concealed areas of the body, right? Concealed areas of the body. Axilla, right? In the nape of the neck, anterofrontal, right? Inside the vagina, rectum, anus, all these concealed areas. The point is, most of the times, it may get unnoticed. That is the point that you need to remember. It may get unnoticed if you're not actually looking for it, right? You may miss this, okay? They are basically present in the concealed parts of the body. Punctured wounds present in the concealed parts of the body. We need to look for it, otherwise it may get unnoticed, right? Unnoticed. Now you see, this is another important thing that we need to know. What you are looking at is called the lines of Langer. Lines of Langer, also called as cleavage lines. right? They are also called as cleavage lines. What are they basically? They are basically the collagen fiber arrangement in your body. Collagen fiber arrangement in your body. Do you see real line like this on the body? No, never. You see, they are all imaginary lines representing the collagen fiber arrangement in the body. Why is it important for us? See, this is important because you can see that, let us assume that you can see these are all the fibers, collagen fibers in the body, right? This is the pattern of flow. Now, in case if the stab injury is placed something like this, perpendicular to the lines of Langer, what happens is it is cutting the collagen fibers. So because of that, you will get extensive gaping. The gaping will be more if it is perpendicular and cutting the fibers. In case if the stab wound is placed parallel to the fibers, if it is placed parallel to the fibers, you can assume that the fibers are not getting cut. So here the gaping will be less. The gaping will be less. Very important. Okay. So that is the same concept under which you have the placement of different surgical incision. So to make sure that the gaping is less, the scarring is less, the complications is also less. Okay. So this is again one very important point that you need to remember. Right. So we have discussed about the stab wound. Right. We can have the stab wound homicidal. Right. We can have the stab wound suicidal. Right. We can also have the stab wound accidental. Can be anything, manner of any type. Right. Person falling from the top. Right. There was one protruding object in the fence. Person falling onto that. Accidental stab wound. Right. Homicidal. Homicidal is very common. But there is one word that you have to remember, one term that you have to remember, that is called overkill. Multiple stab injuries. See, one stab injury would have killed the person. The victim is so pathetic. You would have killed that person with one stab itself. But because of that rage, what happens is the accused was stabbing multiple times, more than 50 times, 60 times. The person was stabbing the victim. Right? This multiple stab wound more than what is necessary to kill the victim, that is called stab, overkill. Just know the terminology overkill. Now coming to suicidal, this is again very important because here is where we have one important term that we have to learn, that is called harakiri. Right? What is that harakiri? Harakiri. Harakiri is suicidal stab wound abdomen. Suicidal stab wound abdomen. Right? Self-inflicted. Obviously, suicidal self-inflicted. Right? Which is also called as seppuku. This is usually practiced by Japanese soldiers. This was usually practiced by Japanese soldiers. See, whenever they get caught, let us assume that they get caught with the enemy army. Instantly they want to commit suicide and die. They will take a long sword, stab into the left iliac fossa, cut the abdominal wall, commit right iliac fossa, cut into right hypochondrium. The big L-shaped incision in the abdominal wall, the point is abdominal wall is cut open. When the abdominal wall is cut open, what happens is there is sudden evisceration. Right? There is evisceration. When there is evisceration, there is sudden decrease in the intra-abdominal pressure. When there is a sudden decrease in the intra-abdominal pressure, the person will have circulatory collapse, hypotension, and the person will die immediately. Death will be the result. Right? Which is called as harakiri, also called as seppuku. Right? Suicidal stab wound abdomen. Harakiri. Right? There is one more interesting terminology I'll tell you, that is called jigai ritual. What is that jigai ritual? Right? See, this harakiri, Japanese soldiers, they usually males, but jigai ritual is practiced by Japanese females. That is not stab wound abdomen. What they'll do is they'll cut the jugular vein in the neck. They'll cut the jugular vein in the neck by a short knife and they die immediately. Right? They cut the neck jugular vein with a short knife, usually practiced by Japanese females, called jigai ritual. Okay? So harakiri, jigai ritual. Now we're going to learn one more important injury, that is chop wound. Right? This is quite unique because this is produced by heavy, sharp weapon. Heavy, sharp weapon. You can see that This is basically a combination of both blunt and sharp together. Okay, both blunt and sharp together, right? So producing what is called as chop wound. Producing what is called as chop wound. Can you tell me one weapon which has got heavy but sharp? Yes, what is that? You can say this is the weapon, right? You can see this is the handle of the weapon, and this happens to be the blade of the weapon. This happens to be the blade of the weapon. Okay, fine. So basically it is axe, right? Fine. What happens? See, let us say this point, we can call this as toe, right? This point we can call this as heel. Fine. So this is a heavy sharp weapon. You can see this is a heavy sharp weapon. You take that axe and keep it on the, put it on the head of the person with force. What happens here? You can see this is a heavy sharp weapon producing what is called as chop. You can see this is chop, right? Now you look at the chop wound. What are the characters of the chop wound that you need to learn? You see, the chop wound, we can see it will be a deep gaping wound, right? It will be, you can see this is a deep gaping wound. Fine, right? The margins would be regular, maybe sharper because of the sharp edge of the blade. Margins will be regular, right? It is deep gaping wound. Because of the thickness of the blade, it is very gaping, and on the adjacent surface, what you can see is adjacent skin, you can see some kind of bruising over there, right? You can see some kind of bruising over there. Fine, right? That is also very, very important. Adjacent skin will be showing bruising in the adjacent region. What is more important? You can see that this is the blade, right? This is the heel, right? And this is the, let us say this is the toe. Fine. When this axe is hit on the, when this axe is hit on the head, what happens? This heel surface will be producing more depth, whereas this toe surface, it will be producing little superficial wound, right? Here you can see this area will be deeper, and this place it will be superficial, right? From that, what can you find out? You can find out the direction of the force, right? You can find out the direction of the force. You can find out the relative position between the assailant and the victim, right? So this is very, very important, the direction of force, by looking at the depth of the chop wound. Okay, so that is again important. When you look at the floor, of the chop wound, the floor of the chop wound will be showing lot of crushing, right? Crushing of tissues can be noted. Not only that, one more very important feature that will be there, that is, you would obviously find underlying fracture would be noted, right? Underlying bone fracture can be noted, right? You can have a look at it. So this is the underlying bony fracture. This is the underlying bony fracture that you can see in the chop wound, right? Very, very typical. See, if you look at this chop wound, right, it can be homicidal very, very commonly, right? It is mostly homicidal. Chop wounds are mostly homicidal, particularly which is in the head, right? It may be accidental. Mostly homicidal, right? Maybe accidental, right? Suicidal, no, right? A person will not take an axe and put it on the head and die, right? Again, it's very painful, right? So homicidal is mostly homicidal in nature. Fine. So this is about the chop wound that you need to know. Fine. And if I want to summarize all the important wound, let me just draw so that you will understand it better. So this is your laceration. You can see irregular shape. Margins will be irregular. Number one, it is irregular shape. Margins will be irregular. Inside that, you can see crushing along with tissue bridges, right? Crushing along with tissue bridges. This is laceration. And you can see this is clean cut regular margin, this is incision. May have tailing, right? So this is incision. Clean cut regular margin, there is no tissue bridges. In the floor, everything is cut. In laceration, in the floor, everything is crushed. In incision, everything is cut. Now you see, this is your chop wound, deep gaping wounds, right? You will find some bruising in the adjacent skin, right? And in the floor, crushing will be there, fracture will also be noted. Crushing will be there, fracture will also be noted. So that is chop wound. That is chop wound. Fine. Right, so that is what you need to know. Now coming to what is called as defense injuries. Defense injury. See, these are the injury when you are defending. These are the injuries which are sustained while you are defending yourself. Right, because of the defensive action of the victim, the injuries will be sustained. So that is called defense injury. There is something called active defense injury, where when you are trying to grasp the weapon. Right, when you're trying to grasp the weapon, you get something called active defense injury, which is very commonly seen in the palm, fingers, and first web space. Right, when you're holding the weapon, it will land particularly in the first web space, maybe here, maybe in the palm, anywhere you can get injury. And depending on the type of weapon that was there, you can have injury. Maybe a cut injury, maybe a chop injury, maybe a blunt fracture can be there, depending on which weapon that was used. Right? There is another type of defense injury, that is passive defense injury, wherein you try to protect. Right? Normally we try to protect the face, right? Something like that. When you're lifting your hand and trying to protect your face, the medial margin of the forearm will get injured. That is important. The forearm will get injured, particularly the ulnar margin of the forearm will be injured. Right? Not the radial margin. You cannot defend yourself by showing like this. That is not possible. Right? Fine. So you have active defense injury. You also have passive defense injuries. You can see these are the defense injury. This is active when you're trying to grasp the weapon. This is passive when you're trying to. So this is passive. Right? This is also active. Fine. Right? I told you, depending on which weapon that was used, the injury will differ. And what does it tell you? Defense injuries tells you that it is homicidal. Right? And is it mandatory that you should have defense injury in all cases of homicide? Is it compulsory that you should have defense injury in all cases of murder cases? No. Right? It is not mandatory, because a person who is unconscious will not be defending himself. A person who was attacked from behind will not be defending himself. You will not have defense injuries. So it is not mandatory. If it is there, it is homicide. If it is not there, right, you need to look for the other findings. Fine? It is not mandatory. There is one more type of wound, that is called fabricated wound, also called as fictitious wound. That is fake. Right, with some intention or with some motive. They are called as self-inflicted or self-suffered. Self-inflicted means I take a knife, I cut myself, that is self-inflicted. I give this knife to my friend, I ask him to cut my hand so that I will go to the police station, I will file a complaint against someone. So that is self-suffered. Right, with my permission, if my people inflicting wound on me, that is called self-suffered. I am suffering. When I inflict on myself, that is self-inflicted. Okay, normally there will be a motive. It is done with some intention. Where do you normally see this? It is normally seen in the accessible parts of the body. And this accessible parts of the body, it is applicable only for the self-inflicted. If it is self-suffered, it can be seen anywhere. Right? Type of wound. Usually it is incised. Wound. Other wounds may be painful. Right? Sometimes superficial burns also noted. Right? You cannot have chop wound, you cannot have laceration, all these will be painful. The most common one is incised wound, and sometimes what happens, the clothing will be intact. If I want to inflict myself incised wound, I will take the knife, I will just remove my shirt sleeve and then I will start putting. So you can easily find out whether it is self-inflicted or it is the wound produced by the assailant. History does not correlate. With the findings. Right? You will tell that injury was sustained fresh. But when you look at the injury, it looks like 3 days old. The history does not correlate with the finding. That is again very important point. You can say that these are called as fabricated wound, and this is also called as fictitious wound.